Hi, my name is Courtney Tinker, and today I'm talking about neuromyelitis optica. This is my PowerPoint. Neuromyelitis optica by Courtney Tinker. Description. Neuromyelitis optica is a neurological disease that is very common. It is a heterogeneous condition that causes inflammation to the optic nerve. It affects the central nervous system, particularly in the optic nerve and spinal cord. NMO can cause pain in the eye and blindness in one or both eyes. It can also cause weakness, numbness, and sometimes paralysis to the arms and legs. NMO was discovered back in the 19th century by Eugene Devon and Ferdinand Galt. It was first considered to be multiple sclerosis because they share many of the same features, but it was soon considered to be a disease of its own rather than a subtype of MS. People are often misdiagnosed with MS when they actually have NMO. Signs and symptoms: pain in the eyes, loss of vision, weakness or numbness, paralysis of the arms and legs, extreme hiccuping, nausea, spinal cord damage, and loss of bladder and bowel control. Treatment. There is no cure for NMO at this time, and no medications have been specifically approved to treat it. The standard of care for an initial attack of NMO can include some of the following therapies: intravenous high-dose corticosteroids, but if no improvement, they use plasma exchange. Specific factors of NMO. There are an estimated 4,000 people with NMO in the United States and 250,000 people worldwide. NMO is more common in women, greater than 80% than men. NMO occurs in all parts of the world and may be the most common form of demyelinating disease in certain populations such as Africans, Asians, and Native Americans. NMO can occur at any age, in children as young as 3 and adults as old as 90, but appears most often between ages 40 and 50. Images of NMO.
At about 2 in the morning, I woke up and it really literally felt like somebody was pulling my spinal cord out of my brain. It just was the most excruciating pain. She said it felt like she was looking through the ocean. And as a parent, you're not really sure what that means.
I couldn't move after that at all. So Gene got me to the emergency room.
They did a spinal tap a few months later, and that came out negative.
We did do the MRIs. He said it's a cyst, a tumor, or MS.
I went through a year of diagnoses, and I went blind in my right eye.
It was a long process. It was just very frustrating.
About a week later, I saw my neurologist, told him, I'm questioning this MS diagnosis.
I pressed my obstetrician to do the NMO IgG test, which he ordered for me.
And they said, "You have NMO." And I was like, well, what is that?
Most of the physicians they talk to have never heard of the disease, let alone have an idea of how to treat it.
I would be in the ER saying, you need to give me this, you need to give me that.
I'm not trying to be a doctor. I'm not trying to step on your toes.
Please just listen to me. Please, I know what I'm talking about.
She was walking, and by the time that he would concede, she was blind in her right eye, and she was a quad.
At that point, I thought I was alone, because it's like, well, nobody knows about this. Where do I go?
That's one of the great things that the Guthrie-Jackson group is doing, is trying to get better information out there.
Linking patients up with each other and linking them up with a small army of physicians and scientists who are trying to figure these things out.
The energy, the hope, the security that we felt.
A sense of belonging, so that, you're not alone in this disease.
They said, have your doctor call us. If you can't come to us, they can call us. We will help you.
They're relieved at the end to get a diagnosis and a treatment plan. And at the same time, they realize that not very much is known about the disease.
As patients have told us what the disease is, they have defined the disease.
As part of the NMO Clinical Consortium, we can collect clinical information.
Symptoms, feelings, things that you may not even associate with neurologic disease.
As well as to get biological samples, blood samples, for example, to study the science behind the disease.
There was no doubt in my mind. I was going to give up my blood, whether, I had to do it laying on the floor with them still, or however it may be.
And I know it's not something that may benefit me directly, but it's helping out the greater good.
By partnering up with our patients, by making a commitment to them to do rigorous science, and then making a commitment to us to be involved in this process, we're going to be able to study new therapies in a much more efficient, much more streamlined process.
So let's pool our resources, pool our knowledge, and really help each other.
The researcher cannot work alone, the clinician cannot work alone, and we have to work together.
This is more about creating something new that could not be created by any one person alone.
Because it's a team now, and it's not just one person, one mother.
The momentum that's been provided by the Guthrie-Jackson Charitable Foundation will ultimately result in us getting significant answers.
We are better off today than we were 36 months ago, and that is a very rare thing to say in medicine.
What I'm hoping for is that we'll have one of these game-changing moments in our ability to treat people with NMO.
Yeah, definitely a lot of hope. I just hope it will come fast enough.
Telling people, get on it, get your blood drawn for accelerated cure. You have to, because we all have a part in this disease.
So am I optimistic that this collaboration is going to lead to further greatness? Absolutely.
This is my handout, and it is my third visual aid. Neuromyelitis optica. What you need to know about NMO. NMO is a neurological disease that affects the central nervous system. The main parts affected are the optic nerve and spinal cord. This disease can lead to blindness. Symptoms of NMO: pain in the eyes, loss of vision, weakness or numbness, paralysis of the arms and legs, extreme hiccuping, nausea, spinal cord damage, loss of bladder and bowel control. Treatment for NMO. Treatment for NMO. There is no cure for NMO at this time, and no medications have been specifically approved to treat it. The standard of care for an initial attack of NMO can include intravenously high-dose corticosteroids or plasma exchange if no improvement occurs with the corticosteroids.